Okay. Okay. Good evening, Nashville, Middle Tennessee, Southern Kentucky. Those of you as far west as Jackson. Those of you as far east as McMinnville, well, Crossville. Welcome to Pharmacist On Call with your host, Dr. Sean Pruitt. And if you're watching this show, I am your community pharmacist. Everyone, welcome to the February edition, the Black History Month edition. This is your 1 hour forum where you get to call in with those questions and those comments because let's face it, your doctors and your pharmacists are busy. They don't have time. For this hour, I do. So call in with your questions and your comments. The producer has flashed the number on the screen. This show is a special show. This is one of those where we give away free stuff. So for all of you callers out there, if you call in, you will get a free supplement of your choice, depending on whatever the condition is that ails you. For those of you who are out there in cyberspace, Facebook, YouTube land, you can call 615-737-7587 to get on air, ask your question live, and then get a free supplement. It usually goes pretty quickly, so I'd advise you guys to get on the phone and start calling right now. As we usually do, want to get into some birthday shout outs. First, we want to get into Miss Jordan Hardy, my niece. She has a birthday coming up soon. Mr. Malachi Hancock out there in Lebanon, Tennessee. Let's see, got a cousin Reese Garcia. And of course, me, you all know I'm born on Valentine's Day. I'm a Valentine's baby. So shout out to me and my fellow Valentine's birthdays, Nate Haddocks of Haddocks Pharmacy, Dr. Charles Spell down there in Memphis, and my frat brother Rondarius Milan. Happy birthday down there. And I know there's one other Valentine birthday that I'm missing. But hey, this is your show, so we're going to get into your supplements here. Before you guys get to call in, also did want to mention it is Black History Month. So this is something that started out as Negro History Week about, again, one of my frat brothers, Dr. Carter G. Woodson, and then it morphed from there into Black History Month. And the purpose of it was to highlight the accomplishments of African Americans who had just endured slavery, Reconstruction, segregation, to kind of highlight the positives of things that we've contributed to society. So happy Black History Month, everyone. Before the callers start calling in, I guess we will get into some of these supplements here. Certainly the most popular one is people always want to know, what can I take for blood pressure, diabetes, and high cholesterol? Guys, you've got a three for one product in organic beetroot juice. Now, I know some of you are spasming out right there because this does not look like the normal bottle that we carry, and it's not. This is a different brand, and this is actually the first brand that I carried. They couldn't keep up with the volume, so I switched to the other brand, the white bottle that you all are accustomed to seeing. So we've just gone back to these guys because we're running that other company ragged too. So now we're ordering both. Some people say that they think this tastes even better than the other brand that we have. So trust me, guys, this is still organic beetroot juice. So what this does is it gives your body what it needs, your pancreas in particular, what it needs to counteract the effects of diabetes. Your pancreas needs alkalinity. And so this provides the alkalinity that your pancreas needs. So what you do is 1 capful on an empty stomach, first thing in the morning and right before you go to bed. And you will notice that your blood sugar will be lower the next morning. You will notice that your A1C over time will be lower. In terms of blood pressure, this product is full of organic nitrates. And so what organic nitrates do is they cause vasodilation, which means They open your blood vessels up so your heart does not have to work as hard to push all of that blood through. So that's how it brings your blood pressure down, okay? Cholesterol, for those of you who are on statins, this behaves the same way as the HMG-CoA reductase inhibitors in lowering your cholesterol by inhibiting an enzyme. So the numbers come down quickly. Blood pressure comes down in about 30 minutes to an hour, a few hours for your blood sugar to come down, and probably maybe some days to weeks for the cholesterol to come down. So this stuff here is good. If you find that you're one of those out there who are suffering, and many people I've seen suffering from pancreatitis, and that's when you are noticing that you have pain over here and you feel nauseous and you're doing some vomiting, there's pancreatic insufficiency, and it's pretty much the cause of diabetes. Your pancreas just is not functioning properly. But for those of you who have an inflamed pancreas, you will benefit from this as well because this helps heal the pancreas. So not only for diabetes, but the inflammation in pancreatitis as well. So this will help you kick out the enzymes, the amylase and the lipase that you're supposed to be kicking out by feeding your pancreas what you're supposed to have. For those of you who are having liver issues, so if you've got cirrhosis or hepatitis, guess what? This stuff here helps you as well. It has a compound in it called betaine. And what betaine does is it detoxifies the liver as well as help it begin to heal itself. So for you weekend warriors, you like to party a little bit much and get your drink on, this is something that you'd want to take after that to kind of spare your liver. For those of you who are dealing with cirrhosis and hepatitis, and you have pain on this side of your stomach, then it's going to be your liver. On this side is pancreas. So guys, make sure that you can differentiate. And this will help take away some of that pain because of the inflammation down there, okay? I mean, but this does a number of things. People have noticed that their eyesight improves because it also decreases the intraocular pressure, which is the blood pressure in the eyes. So, of course, you get energy from it by helping to produce iron. I would say the only issue that it appears to be with this is for those of you who have kidney stones, the compound called oxalates in here, sometimes they can promote kidney stones formation. So if you have kidney stones, maybe not a good product for you. For those of you who are in end-stage renal disease and your potassium is high, you probably don't want to take this product because it is full of potassium. So, and we've noticed that in some of our kidney patients that, you know, sometimes the potassium will be a little high, but probably something that could be, you know, dealt with by alkaline water and just reducing your dose on this. Okay. All right. So let's see what else we got here. There are a number of people who come in and they say, well, doc, I can't sleep. I've got something going on, you know. So I say, well, talk to me about your sleep hygiene. How are you sleeping? And they will say, well, doc, you know, I don't sleep well. You know, I get up 2 or 3 times a night to go use the bathroom. So I'm like, oh, okay. So it's not an issue where you got something on your mind and you're upset. Your poor sleep hygiene is due to you getting up because your bladder is spasming and because your prostate will not fully allow you to eliminate the urine that you got. So we have a product, and I forgot the other product too, but the primary one is pumpkin seed oil. And what pumpkin seed oil does is it stops the spasming of the bladder during the night when you're laying there and you feel like you've got to go after you've just gone to the bathroom. Well, that's because your bladder is spasming. What pumpkin seed oil does is it slows down those contractions or eliminates those contractions so that you don't have to use the bathroom like you normally do. So I recommend this either solo or for guys in conjunction with saw palmetto, because not only is it the bladder at play, it's also the prostate. And so what happens with the prostate in men as we age, we have hypertension, which leads to, normally the prostate is a little round organ around your little P tube there. And as it begins to swell or constrict, it squeezes that. And so, you're not able to start urinating in a timely manner. And when you do, it cuts it off because this thing is squeezing against it. So if you've ever gotten up, went to the bathroom and laid back down, and shortly thereafter, you were up using it again, that's because of your prostate. So if you got your prostate not letting you use the bathroom appropriately and your bladder squeezing, man, you got a ticking time bomb down there. So I recommend a combination of pumpkin seed oil and saw palmetto for you gentlemen, and for you ladies, the pumpkin seed oil in and of itself should help you with the bladder spasms and the constant going to the bathroom. We've gotten great reviews on the pumpkin seed oil. So it either comes as capsules or as a liquid oil. Not sure how the oil tastes, but some people like it. So bladder, for those of you who have overactive bladders, and let's see what else we got here. Okay, let's talk about. We're still at the part of the year where people are talking about doing cleanses. In fact, I just came off of a cleanse, 3 week cleanse. So I did no meat, no dairy, no sugar, no caffeine. Yeah, caffeine was the worst to detox from. No bread, no nothing, no carb, no pasta, so none of that stuff. So I lost a little weight there. You probably see my face is a little skinnier than it usually is. So one of the things that I did is I also, since I was detoxing, I wanted to get rid of the parasites that may be inside of me, because we're going to have a discussion about parasites on another show, because they are implicated in a number of different diseases, and they've been found in people who were cancer patients, COVID patients, and probably why ivermectin works in people, because there may be a parasite basis for how COVID proliferates. So what I took was a product called Worms Be Gone. You're probably thinking this is CKLS. It's not. In fact, CKLS is out of stock, but this is the same company that makes it. So they have a number of herbs put together that have historically been good against parasites, your fluke worms and Trichinella spiralis and all that other stuff. Especially you're a good pork eater and you're trying to cleanse, or a beef eater. Trust me, they're most likely parasites and all that stuff. We got them in us, especially in those of us who are heavily diseased, especially those of us who love sugar because they feed off of stuff like that. I'd recommend Worms Be Gone. So I take a couple of tablets a day. These seem to me to work quicker than the CKLS. So I think I would take these in the morning, and man, by lunch, I was ready to clean house. So this is some pretty good stuff here. So parasite cleanse, and I think I've had patients ask before on previous shows. So you guys, Worms Be Gone is the name of the product. In fact, those of you who've been asking about CKLS, they're out right now. They have an ingredient that comes only from South Africa, and they're waiting on that ingredient to come in this month, and then they'll be able to make some more. But hey, it looks like we are up on our first break, so you guys stay right there. We'll be right back. Oh yeah, trust to believe. Let's see. All right, all of you out there in cyberspace, this is Pharmacist on Call, your 1 hour community service. If you ask a question live on air, you will get a free supplement. So you can call 615-737-7587. And we have products here ranging for any type of health condition that you could think about: hypertension, diabetes, COVID-19. So we're getting ready to go back live on air. We're here at News Channel 5 in Nashville, Tennessee, doing our 1 hour community service. So we got about a few seconds before we go on here. And we got some questions here I'm going to ask. Okay. All right, welcome back to Pharmacist on Call. Your host, Dr. Sean Pruitt, Community Pharmacist of the World. So as we continued our discussion, we want to talk about, let's see here, COVID-19, so in flu and cold and RSV. I made this product in June of 2020. In the height of the pandemic, I had a lot of customers coming in, and this was before any kind of vaccine was even thought of, saying that, hey, Dr. Pruitt, you need to come up with something natural because people are sick and passing away, and we're scared. So I started doing research on the virus and kind of how the virus proliferates and the pathophysiology through the body. And I found 3 or 4 products that had history of working on previous coronaviruses. And so I came up with Dr. Pruitt's potion, which has done very well since 2020. 5-star reviews on Amazon. In fact, you can't order from Amazon right now because I just could not keep up with the demand. So we're working on getting some more to them right now, and it should be available on Amazon by the end of the month. But those 4 ingredients help the immune system, and they also attack certain parts of the pathogen to render it vulnerable to the immune system and some of the other chemicals there. So you may say, well, Dr. Pruitt, what is in this stuff? I keep seeing you hold this bottle up every month. What's in there? So you've got black seed oil, which we call organic Nigella sativa. You have raw honey from Goodlettsville. Shout out to Johnson's Honey Farm right there on Dickerson Road. And then you've got vitamin D oil, and you've got raw coconut oil. And so each ingredient serves a different function. So I put black seed oil in there because it has a way of modulating the immune system, which means part of what was happening with COVID, what made it so deadly, this virus was taking the immune system and turning it against us. So it had the inflammatory part really affecting our lungs and some of our organs and causing destruction. So people had organ failure, people had pneumonia and all that. So what black seed oil does is it turns that down. So there are 2 types of immunity. So one produces antibodies, the other produces inflammation. We wanted to turn down or down-regulate the one that has the inflammation, and we up-regulated the part of the immune system that produces antibodies. So that is the purpose of the black seed oil. I also used it because once I found out that what COVID-19 does is that it thickens the blood. It causes blood clots. So I needed something that was a natural anticoagulant, a natural blood thinner. And that is what this product is. In fact, it helps thin the blood. And guys, I don't know if you know this or not, but there is a compound in here. There's about 100 plus compounds in black seed oil that is structurally similar to hydroxychloroquine, which some people said they found great results with the virus with. So I believe it's called nigellamine is the compound in black seed oil that is the chemical structure is similar to that of hydroxychloroquine. I put coconut oil in here because it has the ability to strip all lipid-based viruses of their protective coating. So once you take that protective coating away from a virus, no matter what it is, now your immune system can attack it. Now the other compounds in here can attack it. And so it essentially renders it defenseless. So that's why I put coconut oil in there. And also a sidebar, for those of you who deal with viruses like herpes, shingles, coconut oil is great for that. It has a product in it called monolaurin, which is a great antiviral. So, and then caprylic acid, which is also helpful in treating funguses. So that's why we put coconut oil in there. So we had immune system modulating, thinning out the blood to prevent blood clots, stripping the virus of its protective coating so it can't just freely move through the body. Now we got vitamin D. The reason I added vitamin D is because it is very important in the immune system function. So, being in Tennessee, we live above the 33rd parallel, or what you call the equator. And so we don't get as much sun as we need to. And that's our primary source of vitamin D. And so once you get enough vitamin D in you, your immune system is strong, your kidney function is strong, and so you can handle anything. And I will say that it was predicted that COVID-19 would devastate Africa, but it didn't. Guess why? Because you got all those people sitting there right around below the 33rd parallel. So they're getting all that sun, all that vitamin D, and it did not devastate the continent anywhere near as it did, North America and some other places. So I felt vitamin D was very important about, keeping the immune system strong and keeping everybody healthy. Um, and what was the fourth ingredient there? Raw honey. Okay, so I chose honey for a couple of reasons. So one thing honey does is it reduces the severity of that cough, that COVID cough that you have, and it reduces the duration of pneumonia. You may not know this, but honey, once you ingest it, it converts to hydrogen peroxide. Yeah, the little bubbling stuff that you pour in your body. So it acts as a natural antimicrobial. So once I did the research and I saw that all of these separately had some activity against the virus, I was like, oh yeah, this is no brainer. Let me put them all together and use them synergistically. And it's worked very well since June 2020. Like I said, 5-star reviews on Amazon once we finally get some bottles back up there. But this has done very well. Most people who have taken this say they start to feel better after the first dose. So this is nothing that you have to take for days or weeks before you feel better. You take it tonight, you're going to feel better tonight. And so for those of you who are just trying to prevent from getting sick, I suggest you take just 2 teaspoons a day and you're good. If you find yourself sick with COVID-19, you shake this puppy up. Well, shake it upside down because it's so thick. Shake Dr. Pruitt's potion up, 2 teaspoons twice a day, okay? Also, you will need to eliminate any mucus producing foods. So that is no dairy products, that is no sugar. So I know y'all gonna pretend like you don't know what a dairy product is, so I'm gonna tell you. Ice cream, milk, cheese, all of that stuff, eggs, all those are mucus producing foods in addition to sugar. Those are the things that COVID-19 is feeding off of. So you're gonna stay sick. So once you eliminate those, you take something to shake the pathogen out of your body, man, you're going to be good in a couple of days. Also, make sure you're properly hydrated. Now, in addition to the big C19, I have a lot of people who said that they have gotten benefit with their allergies and their sinuses from this. So I now recommend it for allergies and sinuses. So this is for year round. And the reason is you have to think about allergies and sinuses are an immune system response. That's why this is called immune support. So it supports a healthy immune system. And when your immune system comes in contact with something it doesn't like oak, maple, cheap cologne, it will start to present a cascade of inflammation. It will squeeze your lungs together. Your nose will get stuffy because it's trying to keep all of that stuff out of the body, okay? Same reason your lungs tighten up. So what we want to do is we don't want to be uncomfortable like that. So we want to turn that part of the immune system down and tell it to chill out. So that is what this does. So this stops the mucus production, the runny nose, the sneezing, the stuffy nose, the mucus coming all up out of the chest. This stuff does that. This is really a wonder drug, y'all. This stuff is the business. And so we've had a number of people tell me that it pretty much saved their lives when nothing else was there. So allergy, sinus, cold, RSV, I highly recommend this. And then some of you have asked me, hey doc, well, can children take this? Yes, even my children take it. Anyone above the age of 2 is able to take this. My only concern would be, 1 year old and younger, because it does contain raw honey. And so 1-year-olds, their immune systems have not fully formed to be able to deal with the raw honey. So we try to stray away from that. But certainly anyone 2 years old and above, probably a teaspoon would be good enough for them, especially if you have a child who always has a runny nose, who's always sneezing and all of that. In addition to watching the dairy products you're giving them and the sugar you're giving them, which help increase all of that stuff, a teaspoon of this will go a long way towards helping them. So Dr. Pruitt's Potion, pharmacistblend.com is where you can get all these products. So you can go to pruittsdiscountpharmacy.com and it will take you there. But this is what you want, guys, to get your immune system right. All right, let's see. We have got, so for those of you ladies out there, you're going through the change, going through menopause. And so you are having to deal with night sweats, having to deal with hot flashes, having to do with mood swings, ready to fight your whole family for no reason. Well, we have a product called Lydia Pinkham. And what this product does is it helps to pretty much modulate your hormones. There. Help modulate your hormones and balance them out because menopause, you're going to have hormonal imbalances. And so this was actually recommended to me by one of my senior patients many years ago. This is a 10 herb combination invented by a lady named Lydia Estes Pinkham. And she came about this product because she was going through the change. But back then in the 1800s, she was really embarrassed to talk about that with her doctor. And so she put together a set of herbs that helped her calm down her symptoms. And she had, I guess, gone into making it and producing it. So there we have Lydia Pinkham. So if you know someone going through menopause or hot flashes or night sweats, I recommend Lydia Pinkham to them. Again, available at Pruitt's Discount Pharmacy. So give us a call and we can get this to you either by shipping or you can come and pick it up. All right, let's see. Tons of you out there coming in and you're dealing with a skin condition called eczema. And so it manifests itself as very dry and rough patches of skin and very itchy. So I had to come up with a product because none of those creams were working. No triamcinolone, no hydrocortisone, none of that stuff was working. So again, patients asked me to make something for eczema, did my research, and then I came up with this product, which I call my skin and scalp soother, but the nickname for it is eczema oil. We all call it the eczema oil. We offer free samples of this every day too, by the way. So if you're in the Nashville area, stop by for a free sample. We let people sample this and some of the other stuff, just so you'll know that it works and just because we believe in it. All right, so eczema oil, it goes on immediately. And most people say that they get instant relief from the itching. And part of what the other complaint is people will say, well, I get these creams, but it makes the dryness worse. This won't. This will keep that patch moisturized. And I understand what they're saying because once it goes dry, yeah, it does make it still itch and still make it as painful. So we've got some of everything in here. We've got black seed oil. We've got hemp seed oil. We've got lavender oil. We've got tea tree. So we've got a number of different things that act as antiseptic, anesthetic, skin healers. So this stuff right here works from head to toe. So if you got dandruff or hair issues, this stuff will help you out. It relieves discomfort almost immediately. So again, if you're in the Nashville area, skin and scalp soother, stop by for a sample of our eczema oil. And let's see, lastly, before we go to break here, I would say a lot of people come in and they ask about something for their kidneys because, as you know, here in the Bible Belt, we have issues with hypertension and diabetes, and the trifecta is going to be, your cholesterol, all that is going to tax your kidneys. That's what comes from long-standing hypertension. So what do you do to help repair the damage done to your kidneys? I recommend two things. Alkaline water, so get off of the soda and the tea and all the other stuff that you drink that tax your kidneys because the less work your kidneys do, the better they're going to fare off. So all those other things we drink, our kidney has to filter them and kick out all the toxins. So let's give our kidneys the best water there is. Come to Pruitt's Discount Pharmacy. We have Kangen alkaline water. It's the best stuff going. But in addition to that, we need something that's going to work directly on the kidney to help repair some of the damage. And that's why I recommend burdock root. Burdock root has done wonders for our patients' kidneys. It helps the glomerular GFR for you kidney patients who know what that means. Helps decrease your serum creatinine, and decrease your BUN. So essentially, it helps your kidney function get better. All right, so I recommend maybe a capsule or two a day, but this is called burdock root. So if you know anybody having issues with their kidneys, burdock root is what they want, okay? All right, it looks like we're up on another break, so you all stay right there. We're going to be right back. All right, everybody, during a commercial break from TV land, all of you out there in cyberspace, TikTok, IG, Facebook, YouTube, feel free to ask your questions in the chat. And I see you guys over in the chat. So I'm going to answer some of those questions, and then we'll answer them live on air here till we get some phone calls. Really weird. We don't have him. That's strange. But that means I guess I don't have to give out any free products. So for those of you out there in cyberspace, if you call 615-737-7587, you can get a free supplement. So any of the things that I just talked about, you can get them for free if you call in and ask a question. And if that question pertains to any of the products that we carry or anything up here, you get that product for free. If you live out of town, you pay for shipping, or you can come by the pharmacy, okay? And we got a number of questions coming in here from Debbie Williams, Patricia. So, okay, we'll get to you guys' questions here in a little bit. So Facebook is pretty busy. And TikTok, welcome you guys. This is our first live, but this is a show I've done for about 10 years now. This is my 10th season. So we'll be doing this monthly where you get to call in and ask me questions live on air about medication, about supplements, about health in general. This is your show, Pharmacist On Call. So 30 seconds, we're getting ready to go back live on air, and then we'll get to some of these questions here. All right, welcome back to Pharmacist On Call. Your host, Dr. Sean Pruitt, community pharmacist of the world. Your doctors are busy. Your pharmacists are busy. They don't have time. For this hour, I do. So call in with those questions and those comments. So we're going to answer some of these internet questions here. Since the phones, I cannot believe they're not even ringing. So we've got a question from Patricia King. Well, no, first we have Miss Debbie Williams, and she wanted to know something about intraocular pressure and high eye pressure. So I believe that we discussed that already. We were talking about beetroot juice here. And what it does is it opens up the blood vessels in the eye so they can decrease that pressure and help your vision improve. I'll tell you what, gang, another thing that a person came in and said, because the potion was doing a lot of stuff, Dr. Pruitt's potion, the thing I made for COVID, one lady told me she didn't need her glasses as much because her vision had improved. And I'll tell you, mine has too, because now my nearsightedness is kind of resolved and I really don't need these things for close up. Now my vision gets blurry when I have them. So intraocular pressure, Debbie, I would either recommend Dr. Pruitt's potion because it does have vasodilators in it. One of the things that black seed oil does, it also helps to lower the pressure. So you'll get some benefit from this as well, or the beetroot juice. So both would be a good tandem. All right, and so we have Patricia King Williams, lady entrepreneur extraordinaire. And she made the comment that, hey, she didn't know she was supposed to eliminate sugar too. So yes, ma'am, as part of the fast, sugar must go. But a part of any time that you're sick, guys, the pathogens feed on sugar, even cancer. So if you're a cancer patient out there, your doctor hasn't told you to stop eating sugar, shame on them. All right. And I got something else to say about that too. Guys, if your doctor has told you that you're at stage 1 and we want to wait and see what the cancer does, come see me, because I don't believe in just sitting there and waiting for something to get worse. And I think that's just, that's horrible that it happens, because so many of my patients has come and said, well, doc, at first it was this size and now it's gotten really big. When all you had to do was suggest something that they could do to make sure it stays small or goes away altogether. So come see me and we'll discuss what you can do. But it starts with eliminating processed sugar from your diet, guys, okay? Because whether or not they told you, cancer feeds on acidity, needs an acidic body, and cancer needs sugar. So make sure you tell your loved ones they need to eliminate it. If you have the cold or flu, you need to eliminate sugar from your diet, while you're sick, so that your body can starve out whatever the pathogen is. If you have COVID, if you have pneumonia, You need to starve out the pathogen because it loves that sugar. Starve it to death so that it can go away, along with taking something that will kill it. All right. Cheese, dairy, all that mucus producing stuff, that needs to be eliminated too. So while you are sick, while you're having allergies, sinuses, that stuff needs to be gotten rid of too. And I dare say cancer as well. Is that all that stuff needs to be eliminated until you get better, okay? And I know y'all sitting there mad at me, trying to take away my macaroni and cheese. Just while you're sick. After that, you can go back to that, and you can go back to your Baskin Robbins ice cream parfait, okay? But just for a little while, you notice because people are coming in and say, "Well, Doc, I've been sick for so many weeks and all that." Yet you're eating sugar and mucus producing foods as comfort food, but all you're really doing is feeding the thing that's giving you a problem. So let's starve it to death so that you can get better quicker. Okay. All right. So yes, Patricia, you need to eliminate sugar too. All right. Let's see. I think we got another question here. Let's see. Jackie Helms asks, "What can she get for metabolic syndrome?" I think beetroot juice would probably help you out there. But come in the pharmacy. Let's have a discussion because I want to know exactly what you're going through and what your labs are saying. But I think beetroot juice will help you out with that. Holly Kirby up there in Red Boiling Springs. So big shout out to all the Kirbys up there, and Dorothy Stafford and her son Jason, my longtime viewers. She wants to know if there is something that she can take in place of Ozempic. There is, Holly, but it is going to require some work. And so, whereas Ozempic, you take the shot, it mimics a hormone in your body, and it decreases your appetite, but sometimes it has long-standing effects. But what I recommend is a bottle that I did not even bring with me today, but it is called Garcinia cambogia, and it comes from this pumpkin-type fruit called the tamarind plant. So, you all familiar with that? That's where Garcinia comes from. And the active ingredient in it is called hydroxycitric acid, HCA. And so, what hydroxycitric acid does, it helps you lose weight by three ways. One, shuts off your appetite. I'm a big guy, and I told y'all I can eat an entire large pizza by myself. But when I take that stuff, I'm cut down to two slices. All right. Excuse me. The second thing that it does is it blocks an enzyme called citrate lyase. And what citrate lyase does is that's what turns our food into fat overnight while we sleep. So if you had a pizza with all that cheese and all that crust, citrate lyase is allowing all that stuff to be turned to fat. What Garcinia does is it blocks that conversion, and you basically number two it on out because it is highly fibrous. Okay. The third thing that it does is it has a mild antidepressant effect. And so it slightly pushes up your serotonin. So it's kind of like being on Prozac almost, but it keeps you in such a good mood that you don't feel like overeating because you're depressed, especially on the holidays, or break up with a loved one, or you're missing a family member. It keeps your mood up so you don't have the propensity to want to overeat. So that's Garcinia cambogia. So Holly, in addition to that, I would recommend eliminating your nighttime carbs. So that means the stuff that I just talked about, the pizza, the macaroni, the pasta, the rice, none of that stuff at night, okay? Because that's what sticks with you. So I think if you eliminate the nighttime carbs, do some Garcinia, get up on your alkaline water, then you'll be okay. But Ali, I don't think you were a good candidate for Ozempic anyway while I'm thinking about it. But if you are, cool. But yeah, just a little bit of dietary lifestyle modification, guys. And then the nighttime sugar is going to get you too. It's all right during the day because you're moving around and you're burning it, just like the carbs. But once you're slowing down for the evening, the stuff is going to stick to you. So eliminate the nighttime sugar, carbs, and all that. Okay, guys? All right, let's see what other kind of questions we got here. Come on, some good stuff. All right, you're welcome. All right, let's see. We got Linda Wyatt. Wow, so my turmeric girlfriend here. She said the phone is busy, but I have not gotten one call. So okay. So, guys, I know y'all are trying to call in. So my producer is telling me that there is an internet outage, and so it's not allowing anyone to call in, which is just the craziest thing to me. Okay. So she was just wishing me a happy birthday. Again, my birthday's on Valentine's Day. So thank you, Linda. Hope the turmeric is still doing you well, and glad to hear from you. Let's see what else we got here. We'll check out some of the other spots here. Okay. All right. So no other questions. All right. So we'll just continue talking about supplements here, and then we'll go to another break. All right. So a lot of you come to me and say, "Hey, doc, I'm going through arthritis, and this hurts and that hurts. Do you have something natural, or I'm taking chronic pain medication and I'm trying to, come off of it. Do you have something that can help?" And I'm like, "Well, yeah, we got something for you. This right here, Pharmacist Blends Hemp Oil." So this is you probably heard it as CBD oil. So this comes from the cannabis plant or hemp plant. It has 0.3% THC, so it's what's allowed by law. And most people say, "Well, have I ever been? Do you test positive and all that?" We haven't had anybody say they tested positive from it. So, but it's probably because it's such a low percentage. And this has actually helped some of our chronic pain management patients use less of their medications. In fact, we've had some people come in who were taking recreational drugs and they are now off of them. But the issue is not they just want to take them, it's because the body begins to get sick and you have like flu like symptoms, is what we call withdrawal. So this helps with withdrawals. If you know anyone who is slave to uh, opiates, all the street drugs, and they're afraid of getting sick, this will help them stave off those cravings and the flu-like symptoms that they have in the withdrawal, the depression, the nausea, the fever, the sweating, and all of that. So this stuff is good right here. In fact, I think we even had a caller, and it wasn't mine, but he said he came off of oxycodone with it. So what this does, it blocks those pathways. And guys, this stuff here is great. So we offer free samples every day. So if you're hurting, or your meemaw, your papaw is hurting, I'll come on by the pharmacy and we'll give you a free sample of it. The sizes range, or prices range from $20 all the way up to 160 based on the milligram that you want. Um, so this stuff works quickly. You put a drop or so, a dropper full up under your tongue, and pretty much 99% of the people that we let sample them say that the pain starts to go away within the first minute. So this stuff works very quickly. It's not like your pain medication where you have to wait 30 minutes for it to dissolve. We suggest you put it up under your tongue sublingually because that skin is thin, gets right into the bloodstream quickly, and you start to get your relief. Okay. Another thing that this thing helps with is nausea. And so a lot of you people come through, and so this helps with nausea as well. Also, great guys for psychiatric conditions. So it works great for anxiety, works for depression, bipolar disorder, schizophrenia. And the reason is, because what's going on in those health conditions is imbalance of brain chemicals. And so what this does is it begins to balance those brain chemicals out. So for instance, in anxiety, depression, your serotonin is low. So this will push up your serotonin. And again, if you're having issues with anxiety, depression, you don't have any medications, stop by for a sample so that we can let you try this out and see if you start to feel better. Again, most people who we let try it, they start to feel better shortly. So that's anxiety, depression. What happens in schizophrenia and bipolar disorder is a little different. Serotonin is not the issue. The issue is high levels of dopamine. And so what this does is it down regulates that dopamine to acceptable levels. Now, dopamine is our woohoo, our feel good, our party. We can stay up 3 days and all of that. But, during bipolar disorder, that's what's going on. And if it's high enough, you begin to hear voices, what we call auditory hallucinations. You'll have ideations like delusions of grandeur. You'll feel like you will think that you're the president, but you're not. Okay. So what we want to do is bring down that dopamine so that you can rest, so that you can have clear thoughts, so that you don't have all that word salad that's typical from that health condition. So psychiatric conditions as well. If you got a loved one or you yourself are fighting racing thoughts, you're staying up 1, 2, 3 days at a time without sleep, stop by for a sample because this will help you out. Okay. All right. So Pharmacist Blend Hemp Oil, free samples of this, free samples of the eczema oil. And I'll tell you what, guys, it looks like we're up on another break. So you stay right there. We'll be right back. Yeah, what's that about, man? Yeah, yeah. Now, how did that just happen right now, this hour? So yeah, it's something malicious. Has it happened before my show? Really? Okay. Mm-hmm. Okay. Yeah. Yeah. This is pretty odd. I've been doing this show 10 seasons. I've never had a. Okay. All right. Okay. All right. About how long before we jump back on? Okay. All right, guys. I apologize. According to my producer, there is an internet outage, and apparently, this happened 15 minutes before my show, and so we'll power on through it as he said, and hey, we'll just take questions here. But again, hey man, y'all save me some money. I don't have to give away anything on the internet free. I mean, any free samples here. And again, you guys sitting out there, you're free to ask questions. So hey, ask them. Okay. All right, get ready to go back on air. All right, welcome back to Pharmacist On Call. Your host, Dr. Sean Pruitt, Community Pharmacist of the World. So we've got another question here from Miss Pat Askew, and she says, "Hey, Doc, do you have any stroke recovery advice?" Well, what kind of goes on with your strokes, guys, is you're going to lose blood flow to certain parts of your body and movement in some cases. So, any advice towards that? I would look to try to restore blood flow to another place. So, we got a couple of products up here that can do that. Pat, I would recommend, first of all, beetroot juice to help restore some of that blood flow to the areas that you've had there. Because a key to it is A, keeping your blood pressure low and your cholesterol low as well. So we're going to work with blood pressure, which this does. We're going to increase perfusion of blood through the areas of the body that lost blood. And of course, that's where you had your stroke, right here. We want something that is probably going to not let the blood clot as much. So I recommend maybe a baby aspirin or full 325 milligram aspirin, just to make sure that the blood is flowing smoothly through the body. And then we would want to get something for the cholesterol. So that could be either beetroot juice or a product called red yeast rice. And it acts kind of like your statins do, but it's natural. And so it reduces your cholesterol naturally. So those are the two or three products I would recommend. Again, the key to it is keeping your blood pressure low, keeping your cholesterol low, keeping your blood thin with something like aspirin, and then certainly just increasing the blood flow. And you know what? Actually, I've got a product here called L-arginine, which is really good as well as far as blood flow goes. I take this right before my workouts. Man, it helps volumize my muscles and all that. It helps my pump. So I would recommend this as well, maybe over the beetroot juice, because you can play with the dose on this. So L-arginine as well. So I hope that kind of answers your question there, Miss Pat. Okay, let's see what we got here. Oh, also let y'all know we carry vintage products too at Pruitt's Discount Pharmacy. So a lot of you all come and say, "Hey, Doc, I need something for energy." We got ya. Good old Geritol from the 60s, 70s, and 80s. We've got it. So stop by, and if you look for something for call for your children, We got Cree Emulsion for adults and children. Father John's as well, 3 6s. So you guys stop on by. And we've got that. Let's see here. Also, we were talking about hemp when we went to break. Not only do we have it in oil form, because I know some people complain about the minty taste, they don't like that. So, what I recommend is you probably get the hemp lotion, and this is pretty much the oil, but in cream form. So it helps with painful conditions, such as inflammation and all that. It also is a beauty cream. So some people use it to tone and tighten their skin. It can help with certain types of rashes, insect bites, like the eczema oil does. So I probably recommend this. Some people's conditions are so serious that they require both. So this generally does the trick, but every now and then you need a little something extra. So if you have inflammation all over, but your knees or your hips or your really pain problem areas, then I would throw a little lotion on there, and that should help you out as well. Let's see. And I've had some people come by. Yeah, I'll talk about a couple of products that aren't up here as well. Turmeric is one, and so it's actually a spice. For those of you who have chronic inflammation, in addition to the hemp oil, I would also recommend turmeric for its high anti-inflammatory properties. The product that we carry is also infused with black pepper, and black pepper increases the bioavailability, which is how much turmeric that your body holds on to so you can use it. So for those of you with those needs, you're getting up in the morning and you're kind of achy, I would recommend that you use turmeric for that. I've also had some people come through and say, "Hey, doc, how can I, build up my white blood cell count? For whatever reason, the white blood cell counts are low." Then I recommend astragalus, which is an herb that seems to help increase the white blood cells, help increase your immune system. Astragalus for that. And then we have people come through with issues for thyroid. So I recommend that you take something called ashwagandha. And ashwagandha does is it modulates not only the thyroid hormones, but it modulates the other hormones as well. So we have people who do really well on that. Make sure that you're getting your TSH, your T4, your T3 checked. And if they appear normal, but something is wrong, then have your doctors look at your ferritin. But yeah, ashwagandha is what you want. So tell your friends and your family who have thyroid issues, that is what they want to get. And I'm thinking one other product before we sign off on break here. Oh yeah, for you guys out there, you're looking for something for your libido and looking for something for performance, and I don't even have one up here. We have a product called Legend. It is one capsule. It works for about 5 days. It's a little purple pill, and so it will increase blood flow to your magical area naturally. And we sell quite a bit of that, and so will not affect your will help lower your blood pressure, but should not interfere with any of your medications. It is all natural. That one capsule costs about $10. We get rave reviews on it. So, and again, it lasts 5 days. So I think that's even longer than your Levitras and your Cialises. So I would recommend Legend for that. And then again, for prostate, for getting up late at night and going to the bathroom, guys, saw palmetto is going to cut all that out. You take one capsule shortly before bedtime, and you will greatly reduce the amount of times that you have to get up and go to bed. But it looks like we are up on another break, so you guys stay right there. We'll be right back. Okay. Oh, that was it? Okay. Okay. I was like, all right, man. How y'all doing? All right. All right. Good. How's it going, man? All right. Full house in it tonight, huh? All right. Okay.
Expos in town, so we got
Oh, okay. All right.
all kinds of guys and tackle vendors and boat dealers, you name it, everybody's in town.
Now, where is this?
Wilson County Fairground, Farm Bureau Expo Building.
Farm Bureau Expo. What's the name of the expo?
It is the Tennessee Boat and Fishing Show.
I think I have been to that. Wasn't one at the Music City Center like a couple of years ago?
Yeah, they had it downtown and stuff.
Yeah.
But they moved it to 11.
Okay.
Interstate, out towards like Mount Jekyll and Knoxville, but it's just 20 miles out.
Probably better given the traffic. Yeah.
It
Yeah. Okay.
It says, and there's a ton of things there.
Okay.
It's supposed to be there.
Okay. So this is the fishing boat expo.
There's fishing boats, there are lake boats, ski boats, center console, pontoon boat, tri-toons, and then there's baits and other products and everything.
Okay. Are you the organizer of the event? Right there. Okay. All right.
Zest is, it's his expert.
Okay. All right. Good
He
stuff.
does them all over the country.
All right. Good deal. All right, everybody. We're in our last segment here. So we'll come back. We'll do our closeouts. But look, if you have any questions about any of the products, give us a call or stop by the pharmacy or just chime in through the chat line there. And we'll see you next month. So hang on here. 30 seconds. We'll be right back on there and then we'll close this thing out. Oh, how long will I have? Okay. All right, cool. Mhm. All right, this is Dr. Sean Pruitt, your community pharmacist. Everyone, thank you for a great show. I apologize for the internet outage affecting the phones, y'all. I've been doing this thing 10 years. I've never seen anything like it. So guys, I'm sorry. We'll make it up, and we'll probably do a free show next month if we can get the phone systems together there. But this is Dr. Sean Pruitt, your community pharmacist. See you next month. Thanks, sir. All right, everyone. See you later.